Menopausal women dealing with moderate to severe hot flashes may want to ask their doctors about a newly approved oral drug treatment. The FDA approved a once-a-day prescription pill called Veozza. Health experts say it may be a quality of life game changer for the 80% of menopausal women who deal with hot flashes. Let's get into this a little bit more with Dr. Jeff Potoff. This is a hot topic for sure. UW Health's Chief Quality Officer. We always love having you on. Today we're kind of talking an array of topics, so our viewers should bear with us at home. All of it very interesting and kind of covering the field here. Let's talk though about this drug. Could this really be a game changer for women?
I think for some women it could be. So, I don't have personal experience, but those women I talk to, hot flashes can be very uncomfortable, very disruptive. And for the vast majority of women, hot flashes can be addressed with estrogen. Unfortunately, there's a good number of women who can't take estrogen. Either they've had previous breast cancer, that estrogen would be a problem there. There's a few other use cases, and they've kind of been out in the dark as far as a treatment. This medication that has just been approved will help those women. It doesn't work quite as good as estrogen. Estrogen about 90% effective in reducing hot flashes. This one about 48% effective, but certainly something better than nothing for those women who can't take estrogen who suffer from hot flashes.
And I know a lot of them experience, upwards of 50 or so a day. So if they could cut that number down to 25, I'm sure they'd probably be a little happy about that. We are getting closer and closer to summer. People may be trying to shed a few pounds before bathing suit season. There's a new warning, though, coming from the WHO about using those artificial sweeteners as a way to cut calories. What are they advising?
Yeah, the data has been building on this, and this is one of those things that doesn't really make sense, but is true. So we think that when we eat or drink diet sodas or products that contain artificial sweeteners, we're not getting those calories, therefore they must help us lose weight. And it turns out probably not. So it's true that those calories aren't in the artificial sweetener, but they do stimulate parts of our brain that make us crave sweet foods. So we tend to eat more of other things that actually washes away any benefit that we get from these artificial sweeteners. There's also data that suggests some of these artificial sweeteners are associated with bad things like cancer and things like that. So what the World Health Organization is saying is, don't put all your faith in these artificial sweeteners. They probably don't help so much with weight loss. They may have some adverse effects, and certainly they're not saying just drink regular Coke now either. They're saying we should probably try to eliminate or reduce the amount of sweet foods that we're eating.
Yeah, there's no shortcut here is basically what they're trying to say. You can't drink a Diet Coke. It's not the same as drinking a glass of water. No way, no way.
Seems so unfair.
Well, we seem to always get emails from the American Red Cross asking for help with blood donations, helping to get the word out because of the constant need for blood. Now there is a new pool of people who are eligible to be donors for the very first time. What's changed?
Yeah, what we're seeing is that the screening process that happens for blood donors is being created a little bit more specific. So it used to be that individuals who were men who had sex with men, were gay or otherwise, were excluded from donating oftentimes. And those rules kind of came about during the 1980s with like the HIV, AIDS, our ability to ascertain whether blood had these things in it was limited. Our guidelines are now being updated to what most countries have, where it's an individual risk assessment that's filled out that will make a lot more of these folks who would like to be part of the donor pool eligible to donate blood with just passing a questionnaire that is, much more specific, not just blanket exclusions with just a few factors.
Well, and that will certainly help because they are always in need of that. It only has a certain shelf life, so if we can expand that pool, that's always a good thing. Dr. Potoff, we always appreciate the insight.
Thank you.
Thanks for being with us.